Calmare Therapy Treatment provides transdermal modulation of pain responses. How does it work? It works by transmitting low-frequency stimulation to the nerve using electrodes in tandem at pain areas to provide pain relief and pain control. Surprising! Pain relief and pain control without drugs, even for types of pain resistant to drugs. The Calmare device rests on a storage cart with wheels that lock. The device has 5 independent channels. Insert 5 cables into the 5 channels and lock them to the device by turning the metal collar clockwise. Each cable separates into red and black leads, where disposable, self-adhesive snap electrodes are attached. The placement of the electrodes on patients will be introduced in the patient setup segment. To use the device, place the cart into the desired area and lock the wheels. Plug the power cable into the rear lower side of the device and the plug into a grounded socket. Completely rotate counterclockwise the 5 dial selectors on the front panel to 0 level. Turn the device on by pressing the switch next to the power cable in the back of the device. Go to the navigation panel on the right side of the front of the device and press the on and off button. The 5 channels are each equipped with a series of warning lights to constantly monitor the proper operation of the device and monitor functioning. Ready lights indicate the channel is ready with output level on 0. During treatment, the dials are turned clockwise to increase the stimulus output. Meter lights display the stimulus intensity with a range from 0 to 70. Each dial selector for each output channel manually regulates stimulus magnitude. During therapy, warning lights flash on and off. This activity enables you to constantly monitor the correct operation of the device and session in a dynamic way. To verify the correct functioning of the device, it is sufficient to check warning lights M0 through M7. For example, when the device is turned on, they light up in sequence and then flash in sync. This indicates the device is in standby mode. The R and T lights flash back and forth to indicate the system safeguard is running. By pressing the right and left navigation buttons down simultaneously, the user clears the treatment program memory. Clear the treatment program memory before treating a patient to clear the last treatment session. Pressing the upper and lower navigation buttons increases or decreases the desired time for treatment. The average treatment time is 30 minutes for neuropathic pain and 45 minutes for oncologic pain. However, patients' treatment varies from 20 to 60 minutes. Set the desired treatment time. Pressing the middle selector button turns on and off the beep tone that indicates the end of the treatment. The device does not exceed 5 milliamps, thus ensuring safe treatment of patients.
Jack, so how long have you been having this pain?
About 1.5 years.
Okay, and so it's down the lower back. Can you feel that?
Yes.
Okay, and you said the pain goes down the right leg?
Yeah, it shoots down the right leg.
Okay. On a scale of 0 to 10, what is your pain level right now?
It's about an 8.
Okay, it's consistently an 8 at all
Yes.
the time? And so no matter what position you're in, walking, standing, sitting, you're feeling the pain?
It's uncomfortable all the time.
Okay, Jack, why don't you put your arms by your sides, please? And you said it's bad, it's about an 8, and you're saying that it gets worse when we bend over too, right?
Yes.
Okay, so why don't you bend? Do you feel it here?
Yeah.
Okay, all right. What the next step will be is I'll have you lie on the table, come back up to me, and then we'll treat you.
Okay.
Okay?
Once the therapy duration has been set, it is time to treat the patient. Patients may present with multiple areas of pain on their body. Determine where the pain area is located that will be treated first. Electrodes are placed above and below the pain, not directly on the pain. Start by placing the black electrode in channel 1 on one side of the pain and the red electrode on the opposite side of the pain. Electrodes may be placed vertically or horizontally. electrodes must be placed in the same color format, all black on top or on the left side, and all red on the bottom or right side. For sciatic pain, electrodes may be placed more laterally to the outside. Placing electrodes on the sagittal plane of the spine is safe and effective in relieving a post-op surgery or neuropathic disc pain. Once the first electrode is placed, turn the dial on the first channel to the maximum value of the threshold of each patient's tolerance. Ensure that the patient does not have pain or discomfort, such as pinching under the electrodes. The intensity may have to then be reduced. The patient may still feel pain. If the pain has lessened, place the electrodes from the second channel on the patient, remembering that black is on top for vertical placement or on the left side for horizontal placement. Add electrodes as needed. If the patient still presents with pain, electrodes should be moved until the patient feels no pain. Ensure the patient is not feeling any pain before making them comfortable for continuation of treatment. Once the patient feels no pain, make the patient comfortable and finish the treatment. Support pressure points to make the patient more comfortable. Some patients may say that the pain has now moved. This occurs when the primary pain has been eliminated in one area, where secondary and tertiary pain may present because the patient is not now feeling the primary pain.